Okay, and with that, so Dawn, we are going to do the round robin.
As quickly as we can. And the reason we record is for people who aren't there, that they want to look at see the meeting, that they can. So that's why we record.
So it's important that we all get to know each other here in Fayette County who are in the people business. So if you wouldn't mind, we'll go around the room and say our name and our organization. We'll just limit it that for now. And because we got 3 great speakers lined up. So I'm going to go across my screen. So that's the best order I'll try. Greg, do you want to say hi first?
Hello, Greg Georgiani here at the Real Life Center in Tyrone.
Thanks, Greg. Mike.
Mike Conaway with the Healing Bridge Clinic in Peachtree City.
Thanks, Mike. Kim Campbell.
Hi, I'm Kim Campbell with the Healing Bridge Clinic in Peachtree City.
Thanks, Kim. Tara.
There, my name's Tara Hannon. I'm with Drug Free Fayette as the youth liaison.
Sheila.
Sheila?
You're on mute, Sheila. I don't know if you know.
Hi, Sheila Pace at AVPRIDE. Good morning, everyone.
Morning. Thanks, Sheila. Pat, would you like to say hello?
Yeah, good morning. Pat Burke, Midwest Food Bank.
Thanks, Pat. Ted Kirk.
Good morning. Ted Kirk, retired and working with BFF.
Thanks, Ted. Daniel, I know we're going to introduce you again, but why don't you just go ahead and say hi now.
Good morning, Daniel Rodgers. I'm with the Fayette Care Clinic in Fayetteville.
And one of our speakers today, as is Dr. Tami Morris. Tami, would you like to say hello?
Good morning, everybody. I'm Tami Morris with AVPRIDE.
Thanks, Tami. Kat.
Good morning. I'm Kat Muncher, and I'm with Healing Bridge Clinic in Peachtree City.
Thanks, Kat. Kim Heron. Hello.
Good morning, Kim Heron, Fayette County Public Schools.
Thank you. Noni. Hello.
Good morning, everyone. I am Noni Walton with the Oak Leaf School in Fayetteville, Georgia.
Thanks, Noni. Kim, I'm going to let you introduce 2 people.
Yeah, hi, I'm Kim Williams. I'm with Grace Church, and this is Melody Benson.
Also great. Hello to you both.
Thanks.
Shanika, good morning.
Good morning, Shanika Brown, Fayette County Schools.
Great. Kelly, good morning to you.
Good morning, everybody. I'm Kelly Green, part-time with Fayette Factor, and right now a standing counselor for maternity leave at Braylon Elementary.
Oh. All right. Lisa Stanley.
Good morning. I'm Lisa Stanley at Fayette Factor. I'm the Director of Resource Development. Good morning.
Morning.
Good morning.
Julie Turner.
Hey, good morning, everybody. I am a recently retired educator and community member.
Great to have you here, Julie. Lynn, how about you? Good morning.
Good morning, everyone. I am the interim executive director at Promise Place.
Excellent. Jessica, good morning.
Hey, good morning. I'm Jessica Gordon. I'm with Fayette County Facts.
Great to have you here. Selena, good morning to you.
Morning. Hi, everyone. I'm Selena Daniels from AVPRIDE.
Thanks, Selena. Glad to have you here. Yulene.
Thank you.
Hello. Good morning.
Morning. My name is Yulene Popp. I'm a school social worker at Fayette County Schools.
Great. Thank you. Dr. Patterson, good morning. Would you like to say hello?
Good morning. This is Jonathan Patterson from Fayette County Public Schools.
Great to have you here. Paige, good morning.
Good morning. This is Paige, and I am from AVPRIDE in Fayette County.
Thanks, Paige. Zena, good morning.
Hi, good morning. My name is Zena Sanders, and I'm the interim shelter manager at Promise Place.
Great, thank you. Debbie, would you like to say good morning?
Good morning. I'm Debbie Straight with Fayette County Safe Kids.
Debbie Straight. Debbie, what we're asking people to do, if you know how to do this, is add your last name and your organization and your Zoom name. Do you know how to do that?
I don't, but I can ask somebody and we can figure it out.
Well, I'll tell you real quick. We're all learning. You hover the cursor over your picture, and when you do that, a little blue box will show up on the top right of your picture. It has 3 dots, and you click on it, and then you can click on the rename button and just add your last name.
Okay, I will do it.
Great. And we have a phone, 404-437-374-0492. We can't hear you.
Can you hear me?
Now we can, yes.
Okay. Hi, this is Dr. Martin. I'm one of the school social workers and I'm out on the road, so I'm going to be participating by phone.
Great, thank you. And was it Dr. Martin?
Yes, Dr. Michelle Martin.
Great, thanks, Michelle. I'll add your name to your box so we know who you are.
Thank you.
You're welcome, thank you. The pictures were jumping around on me, so I might have missed someone. Did I miss anyone?
Yes,
Melanie?
you did.
Yeah. Melanie, would you like to say hello?
Yes, good morning, everyone. My name is Melanie Holt. I'm the parent liaison at Bennett's Mill Middle School.
Great, thank you. LaChance.
Good morning, everyone. I'm LaChance Harrison Roberts, and I'm president of the Fayette Southern Crescent Civitan organization. I'm on the phone because I'm still on campus, but I've sequestered myself, so I won't be noisy. I promise.
All right, thank you. And did I miss anyone else? Kim just joined us. Hi, Kim, Brian. You're on mute, Kim.
See that. Hi, I'm Kim Bryan with the Fayette County Schools.
Thanks, Kim. Krista, I saw you too.
Yep. Hey guys, I'm Krista Gantz with the Georgia Center for Child Advocacy.
Excellent. Anyone else? There, Margaret, thank you.
Margaret Coleman with AVPRIDE.
Hello, glad to have you. Anyone else? Excellent, 35 people. Brandon. Thank you, Brandon.
Yeah, we want to introduce Brandon. You might have gotten an email. Brandon is a new employee, 3 weeks old. He's our executive administrator. Brandon, would you like to say hello?
Yes, my name is Brandon Kirksey. I'm just looking to help out and assist and learn as much as I can in regards to the organization. So I look forward to at some point meeting each and every last one of you.
Thanks,
Excellent.
Brandon.
And I am Michael Mumper, the Director of Programs at Fayette Factor and Drug Free Fayette. And with that, Dawn, I'll turn it over to you.
Okay, and I'm Dawn Opara, the Executive Director for Fayette Factor. I'm so happy to see all of you all. And as March is ending, I just wanted to spend some time and talk about all the things that happened during the month of April in terms of what happens nationally. And I don't know if you know all of this, but April is also the National Month of Hope, and we could use some hope. It's also the National Month for Alcohol Awareness, Child Abuse Awareness and Prevention. And after this meeting, when we send out information, we're going to give you a whole calendar of events and trainings for alcohol awareness. For Child Abuse Awareness and Prevention Month. April is also the month for sexual assault awareness, stress awareness, and distracted driving. And then also on April 30th, where is the Drug-Free Take Back Day, the DEA Take Back Day. So just wanted you all to know that. And Krista Gantz with the, she's the bye-bye. Krista Gantz, if you're not talking, go ahead and mute your phones or your mics. Krista Gantz, who's the Regional Prevention Coordinator for the Georgia Center for Child Advocacy, has an announcement that she'd like to make about human trafficking.
Yeah, thank you, Dawn. And real quick, Dawn mentioned she's going to be sending out our Palooza calendar since April is Prevent Child Abuse Month, we offer all of our trainings and screenings and presentations for free virtually during the month of April. So look for that calendar from Dawn. It's a great opportunity to attend any of our trainings, screenings, or presentations that you might be interested in. There will be a new one on there. It is human trafficking. We are just launching this in partnership with CACGA. We are
Could you say what that is? What the acronym means?
CACGA is the Child Advocacy Centers of Georgia. So they're the ones that oversee all of the child advocacy centers in the state of Georgia. And they also are leading that statewide task force in human trafficking. So we partnered with them to create a human trafficking awareness training for the community. What we are doing is we are starting it in phases. So our first phase is a 1-hour free presentation about human trafficking, where we talk about human trafficking and commercial sexual exploitation. We give community resources that are available for victims. We talk about that trauma, abuse, and victimization of children. We go through the warning signs that trafficking victims may display, and give all of that information out. Again, we're starting with the 1-hour free presentation to get the awareness and the information out. In a couple months, we are going to then craft that into probably a 2-hour long training. And at that time, we will apply for the appropriate CEUs for that 2-hour training and then start getting that training out there. The 1-hour presentation, we will be offering twice during the month of April virtually. And I can also schedule some in the community and do those in the community, either virtually or in person, to get that information and that awareness out about the human trafficking piece. So we're excited about that. And we'll see those 2 phases of first getting the 1-hour presentation out into the community, followed by the 2-hour actual training of the human trafficking piece.
And we are grateful for that, because Georgia, and certainly around Atlanta, has one of the highest human trafficking incidences. Is that correct, Krista?
Yes, Atlanta is known as one of the hubs because we have all of the interstates leading to all of the different places. So human trafficking has been an issue in Atlanta for a long time. And we want to just get that general awareness and that baseline education out to community members, so that they can feel like they have a better understanding of commercial sexual exploitation of children, human trafficking, and the impact that it has, some warning signs to look for, and some resources that are available and out there that people might not be aware of.
Thank you so much. Okay, Lisa, you have, before we bring on our speakers, you have a few announcements to make, correct?
I do. And
I was just going to say, as we have speakers come on, some of you all know that you can put your view in speaker mode so you can see the speaker better. So I just want to make sure you can do that, or remember to do that. Sorry, Lisa.
That's okay. Good morning again, everyone. I have 3 quick announcements. The first one is the most exciting. We're going to start back in-person meetings in April, and we thank Grace Church for their hospitality. That's where the meeting will be located, April 25th. So mark your calendars now. It will be at 11:30. And the best part is Grace Church graciously is providing lunch for all of us. So thank you, Grace Church. Related to that, we just want to make sure that we have all our affairs in order. After being virtual for 2 years, we want to make sure that everyone has their membership applications in by the time that meeting comes up. We want to be prepared. We want to have your name tags ready. We want to make sure we have the most updated information for everyone on your team. We have new members to the organization. We have cell phone numbers that have changed. So we're going to send out an email reminder about your membership applications this week. If you could please just return them if you haven't done so already. And our deadline, remember, is for our next meeting, April 25th, but mark your calendars. We will be together at Grace Church in Fayetteville. The final thing, I should also say, paid members of the collaborative do not pay for lunch. So if you have guests, and there'll be a minimal fee attached to it, but paid members do not pay for lunch for the entire year. The other announcement I have is a program that we mentioned a couple months ago related to a grant that we're working with the Morehouse School of Medicine. And it's through this, it's called the Statewide Network. We are trying to target parents and caregivers, coaches, a youth minister, any youth organization, parents and caregivers, grandparents, aunts, uncles, a mentor, to test out innovations that are coming into our community, into our state, in fact, for parents of middle and high school age students. So if you are a parent and you would like to get involved, we're going to share information about that also. I will put in the chat, we have a page on our website. You need to register to participate. And if you participate, you are paid. We're putting the call out because it's not only for Fayette County, even though we're targeting Fayette County because that's where we are. This grant is for the entire state, and we want our middle and high school age students to benefit across the state. So if you have contacts, if you're part of a group, a team, another organization that has parents and caregivers of middle and high school age students, please let us know. For every time that they participate, they will be paid. And the payments, it's a range start, and it's about 45 minutes to an hour, and they're getting paid up to $25 for every time they participate in a review or intervention. More details can come if you're interested. I don't want to take up much of your time, or if Dawn wants to add anything else, but we're really trying to help them to get more people involved in this very important state program. It's a 3-year program, 3-year grant, and we're really trying to kick it up a notch to make sure that we're helping to make a difference in the community.
Yes, somebody said, is the Morehouse Project a research? It is. Well, it is. What they're trying to do is to have parents engaged with the different innovations to see what works, doesn't work, so they can put together a compendium of good, promising workshops and innovations for parents. They want to have more resources for parents in the state so that they can be better with their teens, their middle school folks. So that's the whole purpose of it. And so, like, if you know, like the association, like the athletic association that works with young people, anybody that works with young people, send that to us and let us know, and who the name and who the contact person is, so that we can contact them and let them know about the opportunity to get feedback, because this is what they want. They want feedback to make sure that the programs that they're putting forth, if they're promising programs, that it goes into what's going to be offered across the state. So that's what they're doing. And it's an evaluation of, it's really an evaluation project to evaluate the different innovations. So, okay. All righty. I think we're ready for our speakers. And if there are any announcements, you have any announcements, any more announcements, put it in the chat. Or let us know if it's something that you want to raise your hand and talk about. We'll try to have some time. But we have 3 wonderful speakers that are all going to talk about their organizations. Remember, this is part of what we're trying to do, is to highlight and elevate our local human services organizations, to know what you all do, what's happening, how we can help support you, so that we can really be more collaborative in the way we operate as a county. So first we have, and hopefully you've seen their bios. So I'm not going to read people's bios because we sent those to you in order to save time. But first up, we have the Executive Director for Healing Bridge, Mr. Mike Conaway.
And Mike, let me just say real quick, we've allotted about 18 minutes for each of our 3 speakers. And Mike, do you prefer if people hold their questions till the end or interweave them while you're talking?
Doesn't really matter to me, Michael. Holding them to the end might be a little easier to because we're going to have a couple of other people speak with me. So it might be best to wait till the end to do the questions.
Got it. So after 13 or 14 minutes, Mike, I'll let you know that we've got 4 or 5 minutes left.
Perfect.
Great.
And you also can put your questions in the chat, and we'll be paying attention to that if people have questions.
Okay, good.
Thanks, Mike.
Thank you. Thank you, Mike. Thank you, Dawn. As they said, my name is Mike Conaway, and I have the honor of being the Executive Director of the Healing Bridge Clinic here in Peachtree City, Georgia. The Healing Bridge Clinic started in 2008 as a vision of Miss Ruth McCammon, who was a recently retired nurse and a member of First Baptist Church here in Peachtree City. Miss Ruth had a desire to fill a gap in the underserved populations with free medical care. She presented this vision to her Sunday school class one day, and quickly the class surrounded her and the Healing Bridge Clinic was birthed. Originally serving the uninsured residents of Fayette, Coweta, and South Fulton counties, the Healing Bridge began seeing patients in September of 2009. For the first several years of existence, the Healing Bridge was open 1 or 2 Thursday nights a month and seeing really a handful of patients each time. Around 2015, the original board of directors went through some changes and a more emphasis was put on expanding the impact and growing our organization. From those well-intended and humble beginnings, the Healing Bridge Clinic took on the task of identifying the true community needs, expanding the impact in the community, and making a difference in the lives of those that we served. A new mission statement was adopted, allowed for more impact, but opened doors to more partnerships and funding. The current mission statement is to care for the residents of Fayette and surrounding counties by providing health care to those who would otherwise be unable to afford these services. Growth has followed this new mission and vision, and the Healing Bridge Clinic began to raise awareness, create unique fundraising events, collaborate with other local nonprofits, and expand the hours of operation, services provided, and volunteer opportunities and care. This plan resulted in tremendous growth for the Healing Bridge Clinic. To give you an example of the growth in 2017, the Healing Bridge Clinic saw about 480 patient visits that resulted in a value of medical care of $241,000. By the end of 2020, we had exceeded over 1,100 annual patient visits, and the value of our services has increased to over $1.2 million annually. I'm proud of the advances that we've made, but I'm even more proud of the team that God has blessed us with. I'm happy to have some staff here today, and I want to introduce you to Catherine Muncher, our clinic coordinator, as well as Kim Campbell, our nurse practitioner. Both of these ladies will be telling you a little bit about what they do, but before I hand that off to them, I just want to say this, that God has provided and will continue to provide for all of our needs. He has brought us extremely talented and servant-minded people, and we have a great team that works hard, respects each other, and has the betterment of our community a top priority in all that we do. So with that, I'd like to introduce you to our clinic coordinator, Catherine Muncher, who we affectionately call Kat, and she's going to share a little bit about herself and her role at the Healing Bridge Clinic.
Good morning, everybody. My name is Kat Muncher, or Catherine, but yes, thank you. I go by Kat, and I am the clinic coordinator for Healing Bridge Clinic in Peachtree City. So a little bit about me. I joined the Healing Bridge team in September of last year. So I'm going to be celebrating my 7 months on Friday with Healing Bridge, and a little bit about what I do at the clinic. So one of my responsibilities is just keeping up with our inventory, whether that's like clinic supplies or ordering medications that our patients may need. I believe that having everything stocked and ready to go is key to having a smooth clinic day. Usually all of our medication orders are through either MAP International or AmeriCares. It is a completely free service to us and our patients, and so we're just so thankful for their donations to our clinic. Another role that I have been kind of dipping my toes into recently at Healing Bridge is our patient assistance program. So basically the patient assistance program that we have, it provides financial assistance to our patients that may need a specific medication that we don't personally have in stock at the clinic. And we basically fill out an application online, and they are able to get connected to a program that they can get medications that they may need at a discounted rate. And in just this last month, we have been able to assist and approve 8 different patients for these services, which is amazing. I'm so happy about that. So another role of mine, which I believe is the most important role as the clinic coordinator at Healing Bridge, is scheduling patient appointments and acting kind of as a liaison between the providers and the patients. So with scheduling the appointments, excuse me, what we do is, let's see. The most important thing is making sure that there's no conflicts with the patient's work, making sure each patient is seeing the best provider to fit their needs. And then transportation has been one of the hurdles that we've had to cross. But luckily, we've been able to partner with Sustento through Uber Health, and we have been able to schedule free rides to and from patient appointments, and having the opportunity to educate our patients about the COVID-19 vaccine and its importance. So we've been super lucky to have this service. It's really made a positive impact in our clinic and has improved the availability for scheduling for these patients. And so what is just as important as having patients at the clinic is our volunteers. So the base of our clinic is volunteers. We've been blessed with an amazing group of people that are willing to just jump in and assist with any of our needs at the clinic, whether that be our eligibility specialists that check in and check out all of our patients and make sure that their information is current and up to date, and our nursing volunteers. And so basically our nursing volunteers, they triage all of our patients, complete any necessary vital signs or blood work for the day, and then they get the patients ready for their exam with the provider. It's been a wonderful opportunity training these new volunteers and learning from each other. It's just been such a great experience with our volunteers, and we're so lucky to have them. Which brings me to another important role of mine is scheduling our providers. So I've been really lucky to coordinate with our providers that are just so eager and motivated, ranging from, we have podiatry, we have general medicine, gynecology, cardiology, orthopedics right now that we're able to offer. And every single one of our providers have just been able to show such kindness and flexibility when it comes to our patients and their needs. But in particular, I wanted to highlight Ms. Kim Campbell. She's on the call with us today. She is our lead nurse practitioner at Healing Bridge Clinic, and she's just always so flexible and understanding. She's been so willing to participate in telehealth appointments if a patient can't physically come into the clinic, or even just giving her advice on best next steps that we need to present the patient with. But she's just such an asset to our team, and I don't think that Healing Bridge would be the same without her. So without further ado, I'd like to introduce you to Ms. Kim Campbell, and she's going to tell you a little bit about herself and what she does for Healing Bridge Clinic. So I appreciate your time, and thank you so much, everyone, for listening.
Wow, thank you, Kat. That was very nice. So as she said, my name is Kim Campbell. I am a family nurse practitioner and basically the primary care provider at the Healing Bridge, although we have a lot of wonderful volunteers, providers that are assisting as well. So I have been a nurse for 35 years. And as I was thinking about that this morning, it kind of dates me a little bit, but I've been a family nurse practitioner for 26 years. And this is my first time really practicing in a nonprofit charitable, free and charitable clinic. And it has been an amazing experience. I'm starting my 4th year here, and I really love working at the Healing Bridge Clinic. We see a variety of patients. We see adult patients, really 18 and up, those without insurance and in the poverty level. So we are taking care of patients who really would not get any care if it were not for clinics such as ours. So it's been a great opportunity. We care for patients with high blood pressure, high cholesterol, diabetes. That's the mainstay probably of the majority of our patients, although a lot of them come in with other chronic comorbidities, having had strokes or seizures in the past, heart disease. We have patients, a lot of patients, of course, with anxiety and depression, and we're able to treat all of those. We're able to get the medications that they need, as Kat already mentioned, as well as treatments, testing, and really able to take really good care of these patients. We offer preventative care, which has been great, trying to keep the patients as healthy as possible and to prevent any further problems. We try to get patients scheduled for their pap smears, mammograms, colonoscopies, all of the preventative care that we all need, but that these patients would not otherwise get. So it's wonderful to see the collaboration of the staff and the volunteers at the Healing Bridge, and you can tell that they really care about these patients holistically, every piece of them, and we all just really work together very well to take the best care of our patients. We have great volunteers, volunteer resources and referrals that we can get to now. And so just some examples of things that we've been able to do in the past. We had a patient who we were able to get into addiction counseling, and she has just celebrated her 2 years of alcohol-free sobriety, and that's amazing. And from that, she's been able to get a better job. She now has medical insurance, and she doesn't need our services anymore. So that's our goal ultimately. But we've also been able to diagnose a patient with cancer and get her to the places that she needs to be, and she's now being taken care of at CTCA and through Piedmont to get the chemotherapy and the treatment that she needs. But we also have a lot of patients that we've been able to get access to ortho and to get the orthopedic surgeries that they would never be able to afford if it not were for the volunteers and the physicians who volunteer their time at the Healing Bridge Clinic. So it's really a blessing to me. I think that it's great because a lot of times we can spend, or I spend more time with these patients than I would in a regular family practice office. We get to know them personally. We help them with just a Kroger gift card or goodie bags that some of the churches provide for us. But one thing that's been great for me is that we can just stop and pray with them. And we have that opportunity to do that and to spend that extra time with those patients. So the Healing Bridge is a great place to work. It's a great place to volunteer. We're always looking for more volunteers from the community. And we've really been able to offer some more services recently, which is great. Kat mentioned cardiology, which has been wonderful. We have a podiatrist that comes to our clinic now twice a month. We have dermatology, ophthalmology, a GYN that's coming to our clinic. So it's really offered a lot of opportunities to our patients that we haven't had in the past. And that's been a great resource. So I'm going to turn it back over to Mike and he can close us out. Thank you.
And by the way, thank you, Kim. And Mike, by the way, we just hit the 5-minute mark.
Okay, perfect.
You're on mute, Mike.
How's that? Thank you, Kat and Kim. I hope that everybody on the call heard just the care in Kat and Kim's voices and how they can interact with others, which is one of the strengths of the Healing Bridge Clinic. Our patients have a great experience when they come to us for care. All of our volunteer providers are servant-minded. They believe in the vision that we're going for, where we're taking the clinic, the new levels that we're striving to reach, and they want to do all that they can to help us get there. And the beauty of having this volunteer base is the text messages that come to me the morning after a night clinic saying, man, the clinic has come so far in just such a short period of time. Thank you for your leadership. Thank you for where you're going with the clinic. It's just a great feel to be part of this organization that's really making an impact in the community. So I want to thank everybody for your time today. I invite all of you to reach out to us. We'd love to have you come and visit the clinic when we're open some days. We're open right now currently Tuesdays from 9 to 1, Thursday nights from 5 to 8. We do not have permanent location. We do share a space with the Hispanic ministry at First Baptist Church. So we're kind of limited on how long, what days our doors can be open, but we're doing all we can to be open as much as we can. We're constantly looking for some permanent, just permanent space. We don't necessarily need a lot of square footage. We need permanent square footage. So we're always looking for that. So anybody in the community that might know of a space that would possibly be a home for us, let me know, please. And I appreciate everyone's time. Michael, if you don't mind, I do see where Ted Kirk asked a question, and I'll just go ahead and answer it while I'm on here. Yes, Ted, we currently have both behavioral health and addiction counseling to us, and we have a partnership with an organization that provides basically 24/7 access to care. And a lot of our counseling resources, because the local counselors are so busy with the results of the pandemic and everyone's overstaffed right now, a lot of our counseling sessions are being done telehealth through this third-party organization that provides services free to us and free to the community. So we'll take any other questions anyone may have.
Thank you. So I just want to make sure, because one of the things we want to make sure we promote are things that you want. And so you're looking for space, and are you looking for volunteers? Is there anything else, Mike, that you're looking for that we can help promote and say, or that any of us as collaborative partners?
Yeah, thank you, Dawn. We're always looking for volunteers. They don't necessarily have to be medical. We can use skill sets of all kinds. Obviously, nursing is a big area that we need help in, but at the same time, we don't turn anyone away from a volunteer. We'll find a way to use your skill set to empower you and to advance our mission. And the only other announcement I'd like to make is on this call is Pat Burke from the Midwest Food Bank. The Midwest Food Bank and the Healing Bridge Clinic collaborate every year on a fundraising golf tournament called For Our Community. It's coming up on April 29th. So if anybody knows any golfers that would like to participate, if anybody knows any businesses that might want to be a sponsor, please reach out to Pat or I, either one. We share the event both from a cost standpoint and from a profit sharing standpoint. And it's great to see our community get excited about two nonprofits coming together for a fundraiser like this. And we get great support from our community. So I want to throw that out there as well.
Well, could you send that to us so that we can put it out, on social media?
Yeah.
And then others, and we'll send it out so other people can put, if they would so like to put it out on social media. Because I think that's the way we can help each other, is when you are doing an event, to be able to share it. Because if they don't see it on your page, they can see it on our page or somebody else's page.
Correct.
And that we can send it out. So that's April 29th. So please send us something so we can help promote that.
Will do. Thank you, Dawn.
Okay. Any other questions? Okay. Thank you, Mike, and thank you, your entire staff. I mean, your Kim and Kat for being here. We appreciate that. And now we would like to introduce Dr. Tami Morris, the CEO for AVPRIDE.
And
Thank you,
Tami, do you prefer questions at the end or interwoven?
Oh, you know what? We work with kids. We're used to controlled chaos. So just ask away.
Either way, I'll give you a 5-minute heads up at the end.
Okay, great. I was going to start a timer too. So I found through the pandemic, and I've talked to other people about this whole pandemic, it's like warped our sense of time. It's warped our sense of like days. They just run into one another, weeks run into the next thing you know, months have gone by. So yeah, thank you for that reminder about time. So thank you all so much. Thank you, Fayette Factor and our collaborative, for giving us this opportunity. I just want to say how much we appreciate the opportunity to get together with everybody. We're looking forward to getting together in person again next month, because we so much appreciate the opportunity for networking and fellowship. And it's just a great service that Factor provides through the Family Connections Network here to Fayette County. So thank you for that. And to Healing Bridge, I just want to say, wow, we just with so much information you all provided, I feel like I have a much better understanding of what you all are doing. And I think there might be some opportunities for us to collaborate. One of the things that Mike mentioned was space. And we are on the lookout for various kinds of space, not only for programming and tutoring programs and different things, but also office space. And so we have been talking to some other nonprofits about sharing some space. So if anybody's interested, please feel free to reach out to me at Tami, Tami Morris at avpride.com. My email address is in the chat box. So if anybody wants to get together and just kind of brainstorm about things that we can do, we would love to get together and just see, what we can do as all of us have similar kinds of needs, and sometimes the spaces are really big, and so there might be some opportunities there. But I digress. Let me tell you about AVPRIDE. AVPRIDE is a 25-year-old youth wellness, development, leadership, and career exploration nonprofit. It was started in 1996 by 4 residents here in Fayette County. 2 of them are on here with us today. One, unfortunately, has passed away, and the others moved to Florida. But I just want to acknowledge Dawn Opara, our fearless collaborative leader here. She was one of the original founders of AVPRIDE, and also Sheila Pace. Sheila, can you come on real quick and just say hi again? Because Sheila and Dawn are kind of like our fearless leaders here. Dawn has been with Fayette Factor for several years, but Sheila, after retiring from the Fayette County school system, I guess she got bored and she couldn't stay away. And so she's come back, and she's been our after school enrichment programs manager for the last few years. So Sheila, can you just say hi real quick? I just want to acknowledge you and let everybody say hi. And I know you had your mask on. Take it off for a minute.
It's off. Good morning, everyone. Yes, we've been around for 25 years. And yes, Dawn was one of my partners in crime. And we started this great organization that we're both very proud of. And we appreciate all the help that all of you have given us. And I hope we continue to have these partnerships and grow many more for another 25 years.
So Sheila's going to be our official spokesperson for the next 25 years. She does such an amazing job. Thank you, Sheila. So the organization started in 1996. It was actually incorporated in 1998. So we've kind of got this roving 25-year anniversary that we're working on. AVPRIDE, in case you all don't know, stands for the Association of Village Pride. And if you think about, that adage that we all hear all the time, it takes a village to raise a child. That's what AVPRIDE is all about. It's about bringing us all together in a common goal to provide for our young people. And what we find is that their needs change throughout the year. So what our kids needed in Fayette County 25 years ago is very different than what they need now. But we do have some common threads, and that happens to be the youth development, the youth wellness programming, which through the pandemic and actually before that has expanded into mental and emotional wellness, the leadership that we do, and we start cultivating them at a young age. In our after school program, we bring them through a middle school programming and different things that they can be involved in. And then our leadership program, formerly known as FLIP, which is now the South Atlanta Youth Alliance, because what we found through the pandemic is that our county boundaries are really artificial in terms of the needs, and people live in one county, they travel through other counties, the kids might be involved in sports that cross across county lines. And so we found during the pandemic that for our teen program, we actually had students, I think it was from 4 different counties. And we actually see this as a growing trend. Our work has changed over the years. Like one of the early programs was a tutoring program in an apartment complex in Peachtree City, for example, that evolved into a family resource center. Currently, we have an after-school enrichment program, and we pick up from 3 elementary schools in Central Fayette. But I'm pleased to announce, and we haven't sent out anything about this just yet, but we have recently found out that we have received for Fayette County something called a GSAN Boost Grant through the Department of Education. And this is huge. This is a large grant. It's a 3-year grant period, and it specifically addresses after-school care and summer camps for kids. And it's a K through 12 focus. But what it will allow us to do is to expand to a second location in North Fayette County, which we are super excited about. So we have been, like Mike at the Healing Bridge, we've been, hitting the streets up there, trying to find a space to expand. And so we will be opening a second after-school enrichment program this year, and also a second summer camp site. So while we are looking for what that space might be, we are working on developing a partnership with the mobile home communities in North Fayette County. And so we will be starting to do some tutoring in it's almost April, can you believe it? In April and May, helping those kids up there start preparing for the milestones testing and working with them. And so we are looking to add more staff. So we're looking for teachers, we're looking for site coordinators, we're looking for volunteers who might like to help us tutor. We need people who are bilingual because there is a large Hispanic population in the north end of the county, which, by the way, abuts South Fulton and also Clayton County. So about 40 to 45% roughly of Fayette County's northeast boundaries are contiguous to those two counties. And so we're finding that perhaps what we're doing in Central Fayette, we may need to adjust to meet the needs of the folks in the North County. And so we were looking for partners, we are looking for people, we were looking for volunteers, we're looking for employees, we're looking for space. So any ideas that you all have about that, we would be totally thrilled to talk to you about it and learn more about that. The other thing that we're doing, and I mentioned it briefly, is this idea of wellness programming. So when I came on board with AVPRIDE in 2018, late 2018 and early 2019, the AVPRIDE board started looking at what the needs of our youth are. And so, a lot of our programming to date has been, and working in tandem with Fayette Factor and Drug Free Fayette, by the way, has been focusing on substance abuse prevention, alcohol awareness, those kinds of things. And we feel those are just so vitally important, but our board decided they wanted to back up the boat, so to speak, and that we needed to really address what some of those core reasons or those underlying reasons are for why our students are engaging in the behaviors that they are. And so many of you are health professionals and you work in the school systems, and you know all about this. This isn't anything new. And we've worked with the school system and as a partner since the inception of AVPRIDE. In fact, 2 of the superintendents were on the original founding board. But what we find is that we have a need to go back and look at what our youth are going through. And so there are a lot of emotional and mental wellness kinds of initiatives that we would like to work with our community partners on. One specifically that we have already initiated some work on is suicide awareness prevention. And so we know, for example, that Fayette County has one of the highest rates of self-harm in terms of emergency room visits. We know that our students have, high rates of depression and anxiety and different things. And the pandemic has only exacerbated all of that. And so we know it takes a village to do this kind of work. And so we want to make sure that as we move forward with these new initiatives, that we all are working together and complementing one another, because as we network, we build a stronger safety net for our youth and their families. So we're excited about that. We also are working in career exploration. Of course, during the pandemic, we had to kind of pull back a little bit on that, but we have done a lot. Margaret Coleman, our youth programs manager, has done a lot in terms of bringing in different people to talk about careers. So we have 2 years, and Margaret, correct me if I'm wrong, but I think we've got about 24 different career talks that have been recorded. And so we're establishing, this probably won't be the right terminology, but I think we're establishing a playlist on our YouTube channel, which is sort of like a a chapter on our YouTube channel. So once we get that all pulled together, we'll start promoting that. So students who are interested in engineering, for example, or working in the media, or becoming an entrepreneur, or any number of other careers, we will be able to go onto our website and find that out. And of course, our teen program, formerly known as FLIP, which is now the South Atlanta Youth Alliance, will continue to have these kinds of career exploration opportunities as we move forward. One of the things we did that we haven't been able to do during the pandemic is to do our career tours. We think that's an exciting opportunity for the students. So it's a full day of going around. We started out at the Chamber of Commerce. We went to the city of Fayetteville. We went to various businesses around town, and just to give students an idea of what it takes to run a community and to see what kinds of different opportunities there are, not only here, but for them career-wise. So the idea is, here are all these different kinds of things it takes to live in our society. Here are different ways for you to plug in and contribute, and to find your passion and have a career that makes you feel proud about what you're doing and about what you contribute to society as societal leaders. So there's that whole piece of it. And then I also wanted to mention the Association of Village Pride is kind of two acronyms in one, and PRIDE stands for People Respecting Differences in Everyone. And so another of our initiatives is to really look at how we can be more inclusive, how we can expose our students to all the diversity in our community, and also to being inclusive in different ways that we do things. So as we look for space, for example, for our after school program, one of the things that is high on my list is to find enough space in terms of outside land where we might be able to partner with a couple other organizations in the community and have an all children's playground. So this would be a playground that would be accessible to all kids, including those who may have handicaps or other limitations. And we're looking at, our transportation, for example, or if anybody has a bus for sale, let me know. Sheila's saying yes. So we have a bus that we're looking to sell, a big passenger, 45 passenger bus, because we found that that's not meeting our needs currently. But we also have a van that's got 90,000 miles on it. So we know we need to up the ante here in terms of our transportation. But as we look at that, we're looking at, well, do we need to have that be handicapped accessible, for example? Thank you, Michael. I think it's actually 4 minutes and 45 seconds. So thank you for the extra 15 seconds. We're also looking at things like our website. How do we make that more accessible for people with maybe sight or hearing challenges? Inclusiveness, pride, people respecting differences in everyone. Sheila's showing the Beauty in the Bags card right now, which brings us to the last point I wanted to make, which is community engagement. So Beauty in the Bags is AVPRIDE's signature fundraising event. It started in 2017, and we haven't been able to do it the last 2 months. But it's back, and it's going to be on May 5th. And we actually have a flyer that I sent to the folks at Factor, who are going to share it with everyone. We have, can one of the staff, can you type in the URL for the tickets, please? The tinyurl.com/beauty, BATB 2022. And that's our Eventbrite site, but you can reach us at info@avpride.com or reach out to any of our staff. We would love for you all to participate in whatever way you can. We are looking for sponsors, as Mike had mentioned, for their upcoming golf tournament. But it's also just a fun night. It's going to be streamlined this year. It's going to be at the Dottie. It's catering by Hannah Brothers, and we're playing bingo for designer handbags. And if you can't make it, you can make a donation. There's also raffle tickets for a very lovely Louis Vuitton bag for those of you who are into handbags. And you can find out more about that on our Eventbrite site, which has the tiny URL. And I think somebody's typing that in. It looks like Sheila's typing it in. So there's that. And then our students, due to our grants through the Department of Behavioral Health and other funders such as SAMHSA, we always have youth action teams that are based in the communities that we work in. And so our students here in Fayette County have been working on a really amazing project, which we hope to unveil soon. Last year, they wrote lyrics to a song after having had a mental health panel at their closing ceremony. The next day, they got together with another nonprofit and wrote some lyrics, and they came up with the lyrics for a song called Free to Be. Now they're working on a music video, which we're hoping to premiere at least a rough cut of it at Beauty in the Bags and at their closing ceremony on May 18th. But they, a couple of the students also felt very strongly that it was important to reach out in a different way. And so our youth are actually hosting on July 16th, a mental health fair here in Fayette County. And we're looking for vendors. So those of you who want to have an opportunity to showcase your services, please let us know. You can reach out to us at info at avpride.com. And again, that's info at avpride.com, not org. And we would love to have you be part of this amazing event. We're going to have events throughout today. They're going to have music. We're going to, have different activities such as yoga. We're open to ideas that folks might have. The planning is underway right now. So the sooner you contact us, the better. And again, that's our Students Mental Health Fair, July 16th. It'll be at the Fayette County Court Complex. And then the last thing I want to mention is our scholarship programs. We have two scholarship programs. One is the Podacostan Memorial Scholarship, and that is for our students currently in our South Atlanta Youth Alliance. But we have another scholarship, and it's called the Oliver Family Scholarship. And Fred Oliver, who was a superintendent, along with Sam Sweat, were two of our founding board members. And he passed away, unfortunately, a couple of years ago. And so we have a scholarship that is open to all Fayette County students, and it is on our website. And if you need more information, we can send that to you as well. So with that, I have 40 seconds left, or Michael, I've got 55 seconds with your extra 15. So are there any questions or comments or anything else that we can let you all know about? We're just super excited. We appreciate every single partner. We've had hundreds and hundreds of partners, many of you on this call today, including Dr. Patterson with the Fayette County School System. So anything we can answer any questions or provide anything for you, we would be.
Anything that you have that you have in that Facebook, social media that you want us to help share, and you want other people to share, put that out so that because that's what we're hoping we're going to do, is share other people's wins and other people's opportunities and fundraisers or whatever they're proud of. So thank you so much.
Yeah, thank you. And thank you all, and thank you for the opportunity. Any
other questions? We got to go ahead and move on. Thank you so much, Tami. We appreciate all that you do at AVPRIDE. Of course, it's special to my heart, as you mentioned in the beginning. So thank you so much.
Okay.
Okay. Now we have Daniel Rodgers with Fayette Care Clinic. Daniel, you ready?
Hi. Yes. Good afternoon. Can you guys hear me? Okay.
335.
Can you hear me? Okay.
Yes, I can hear you. Yeah.
Okay. Hi. Good afternoon. Yeah, my name is Daniel Rodgers. I'm with the Fayette Care Clinic. I've been here since I want to say September or October of last year. So fairly new, but we're about half a year into it. So I'm very honored and humbled that the board has chosen me to serve as the executive director here. I guess I'll go ahead and just give a little bit of a background about the clinic itself. The clinic opened, I want to say, in 2005 in Fayetteville. And initially, we only provided medical care one evening a week. And that medical care was only for people that were uninsured or low-income residents in the community. Since that time, obviously, the organization has grown, including expanding services, increasing hours of operation, hiring staff, and obviously developing relationships with volunteers and community partners. And so as a result, we've been able to help many of the population, the underserved population in Fayette County. One of the things that is extremely humbling is seeing the collaborative effort of my board of directors. I'm a long-time nonprofit healthcare professional. and I've always worked at the intersection between healthcare delivery and civil service. And to this day, I have to brag because I truly, even in my first week, the first week I was at the clinic was the week of the annual golf tournament. And I have not seen such support from the community and the board themselves. There are some wonderful, wonderful people who volunteer and provide services for those that really need it. So I'm very honored to be working here as a little side caveat. But yes, so we perform primary care. We have a wonderful team of highly skilled and licensed healthcare providers, our medical team. We have patients and volunteer team as well. We have 2 nurse practitioners, a medical assistant, an office manager, administrative coordinator, and of course the medical director. And really, oftentimes the uninsured or even underdeserved individuals in the community delay medical care because they can't afford to see a doctor, which puts them at risk of a health crisis due to lack of preventative care. But for those who can manage to see an initial doctor or at least go visit one, they're unable to afford the necessary medications or follow-up care or visits needed to resolve their affliction. And so by providing not only access, but free medical home where they can have an all-encompassing and all-encompassing team engaged in their healthcare delivery, hopefully we're able to reduce a lot of the health crises that we're seeing for our patients now and into the future. And so we partner with many organizations. Like I said, my board of directors is a highly involved board of directors that is comprised of healthcare providers as well, from foot and ankle doctors to cardiologists, dentists, and orthodontists, and things like that, heart surgeons. And so I am so blessed to be able to work with a team that has the compassion.
You ever hear from Rebecca Bell?
I'm sorry, was there a question? Okay, so blessed to work with a team that has a passion for just healthcare delivery and providing it for all, even regardless of ability to pay. So the clinic is in like I said, a transition period. Obviously, when I came aboard, it was in the middle of a pandemic. I know the previous executive director had left some months prior. And so right now we are definitely in a sort of a transitionary period where not only are we looking to add more staff, but looking for solutions for space as well. So when I heard Tami and Mike talking about it, I was right there with you guys. But we are looking to expand our services. Fayetteville is unique in that if you look at the demographic and some of the data, you'll see that it's pretty known that the residents of Fayetteville on average or median income is higher than the rest of the average in Georgia. However, due to lack of Medicaid expansion, there still are gaps in healthcare coverage. So there are people that would qualify for Medicaid had the expansion taken place, but because it did not, they do not qualify. However, because the median income is so high, they don't qualify for other services. And so we have a unique situation here where there is a great need for people to receive our services or likewise, but they're not able to qualify for certain insurances. And then when you add on the underwriting process that takes place, they're never going to be able to afford even Obamacare or things like that. And so what that's caused is the only primary emergency room that we have in Piedmont is Piedmont Fayette, and they are backed up every single day with hundreds and hundreds and hundreds of people coming for emergencies, but a lot of non-emergencies as well. And so the direction that the clinic is looking at now is becoming a federally qualified health center lookalike. And what that will allow us to do is to take not only the burden off of Piedmont Fayette of, having their emergency room backed up with both emergencies and non-emergencies, but it'll also allow us to expand our services for the true population, or more of the true population that really, really needs us. People that are either underinsured or completely uninsured, and people that maybe they do have a decent job, but they have a family of 4 or 5, or maybe they just can't afford full-on health insurance and need some help. And so it'll allow us to operate on a sliding fee scale, and still be recognized and reimbursed by Medicaid and Medicare as well. So we're looking at some positive changes, and I'm very excited to sort of be working with the board and other partners to take the clinic into this direction. I think it's much needed. Now, with that being said, it doesn't take away from the fact that we are still at heart and still at mission a 501c3. So although we will be providing in the distant future billable services, we still are sticking to our mission, which is, to provide healthcare for all who need it. That's never going to change. And so the grants that we currently have, all of the stipulations for those will still be met, and future ones as well. And we'll still be operating under the supervision of an experienced board of directors and things like that. So I am extremely excited, and I can't wait for what the future has in store. I think the key to providing a positive experience for both those who serve in the clinic and for patients who come for treatment is involving the patients in their what's it called, management team process, if you will. So one of the things that I learned when I first entered into this world of healthcare was that the definition of health, I want to say in the last, it could have been 50 or 60 years, the definition of health as defined by the World Health Organization has changed. And before, health was defined as the absence of disease or infirmity. If you weren't sick, you were healthy. In present, health is defined as not only the absence of disease or infirmity, but the presence of social, mental, and physical well-being. And so with that being said, it really makes you, and if the pandemic hasn't taught us anything, it has taught us that health is a lot more than just, do you have a cold or not, or do you have the sniffles or not? Mental health is highly prevalent in our society. Social health is a thing, right? And obviously physical health as well. And so having an all-encompassing path toward treatment outcomes is exactly what we at the Fayette Care Clinic strive to provide our patients. And so with that being said, like I said, we have wonderful community partners that help us, from ankle and foot centers to the dentist office, to we provide behavioral health services, primary care, vision services, and then just being involved in the community as well. Like I said, the golf tournament is actually not a tournament that we run and operate. Another provider in the area hosts the tournament on our behalf, and the proceeds for the tournament go to us. And so we can't do it alone. With that being said, we do have one event that we do host every year with the generosity of other community partners. It's actually coming up May 13th, which is a Friday. So that's Friday the 13th. But we have an annual dinner, annual gala, however you choose to say it, coming up on May 13th. And all the proceeds, like I said, go toward the clinic and providing services for people that truly need it. So I'm very excited about that. We host it at the Glendalough Manor every year. And last year we had to postpone it until December. Usually it's in the springtime. And so they were very generous. I don't know how I got it on a Friday, but we got it. And so that's what we'll be doing. This year. So if any of you are wondering, because I know some questions from before, and in terms of like eligibility and things like that. So the only, let me pull it up here because I want to make sure I say it correctly. The only eligibility requirements that we have as of now, and like I said, it is going to change, is that the individual must be a resident of Fayette County. We only currently serve individuals over the age of 18, and they must be either uninsured or underinsured. And after that, we just ask for proof of residency, and that's about it. So there's very, very little stipulations as long as you live within Fayette County on who can come and who can't receive the services. So I'm very, very honored to be serving the community.
And that was perfect timing. We got just over 5 minutes left for any questions for Daniel.
Your hours of operation, could you just share that? And
Sure.
also information of two things, information about the gala, so that we can help
Sure.
share that information.
Sure. So the hours of operation, currently we operate Monday through Thursday, staff gets there 8:30, so 9 a.m. till 4. New patient registrations take place on Monday and Thursdays. So that's where we go over new patient intakes and things like that. And then all of our referral services and things like that obviously take place outside of the clinic. So I hope that answers that question. And I see a question in the chat, a limitation because of space. Will you be expanding or staying in the same location? So we're currently, we currently do, I guess the technical definition would be outsourcing a lot of our referral services, especially for the specialty cares. We primarily have primary care services in the clinic. We are looking for any opportunities for space, obviously space that can accommodate a medical operation, or we are willing to share the space that we're currently in. The arrangement that we have now is probably not sustainable for just us. So there are definitely options there. And if you had any follow-up questions with that, I'd be happy to answer. In terms of our annual gala, I'd love to see anybody that's on this call there. I've seen a few of you already. It is a wonderful event. The last year's gala, we thought we were actually going to have to cancel it, and we ended up pulling it off in 2 weeks. And in my opinion, we had a great showing and a great turnout, and it was a great time. But yeah, it takes place at the Glendalough Manor. They are gracious enough to give us the facility and provide dinner for us up to, I think, 200 or 300 people, however many we tell them. So they are a wonderful organization for hosting.
Well,
us
if you
there.
have a flyer and you want to share it, please do so.
Yeah, the flyer will be coming out soon. I have to utilize my my artistic skills and create one to make it different than the one that I had in December. But yeah, the date is May the 13th. It's a Friday, and it's at 6 p.m. till 12. So if you'd like, what I can do is at least put my contact information in the chat, and then if anybody that wants to at least get some info on it, I can make sure I send it off.
Okay, and if you send it to us, we'll certainly try to put it up on our Facebook.
Okay.
And tag as many folks as we can, hopefully that they will also do the same.
Thank you. We'll do.
That's the same thing for you, Dr. Morris. Your Beauty in the Bags, we'll put it up. And if you put it up, tag us and we'll tag back and try to add other folks. I think that's the way we get word out about other people's events, that I think we just have to be more intentional about how we share information to support each other. Any other questions? Okay. Any other things you want to add, Daniel, before we move on?
Not that I can.
Well,
think
I have a
of.
question. I'm just noting the similarity between Healing Bridge and Fayette Care Clinic, and I wonder, where do you cross paths, and where do you have separate visions?
Sure. I think there is no separate vision from what I've heard. We are an all-inclusive organization looking to service with a lens of healthcare, service the residents of Fayette County. As I came on board the organization, the policies and procedures or what have you stipulated, residents of Fayette County only. And I know that the Healing Bridge Clinic services surrounding areas as well, including Peachtree City and others. But I think in terms of the intrinsic mission, there are well more similarities than there are non-similarities. And so, we're just in two different locations.
Great, thank you.
Yeah.
Hey, Michael, I'll add real quick to that. I agree with Daniel. Our missions are very similar. The two biggest distinctions for me is we serve Fayette and surrounding counties. And then we're a faith-based clinic. I'm not saying they're not, but like we make prayer part of our meeting with patients. I mean, there's a definite a definite direction in the spiritual aspect of it when we meet with patients. And then the Fayette and surrounding counties. I did some research about 3 years ago. In fact, we're going through and updating our research right now. If you're wondering why Fayette County's affluency needs 2 free clinics, when you look at Fayette Care, Healing Bridge, and the Coweta Clinic, both, all 3 down in Noonan, when you look at Fayette, Coweta, South Fulton, a little bit of Clayton, there's about 30,000 people that live at or below 200% poverty that are uninsured. So if Daniel's clinic, the Healing Bridge, and the Coweta Clinic were all open 24/7, there is no way we could touch 30,000 people in the course of a year. So there is a great need for all of our clinics.
Thanks for those answers, both of you.
Hey, if there aren't any more questions, I want to thank everybody for being here. I want to thank you all for joining. I want to just, for those who didn't hear or got here later, next month we are going to be in person again. And I know for some people they enjoy the virtual because they don't have to drive anywhere, but we do want to be able to see you. And our meetings are a little different when we're in person. So we're hoping that you all will come back and go to Grace. Grace is at 164 Flat Creek. You'll get more information. Flat Creek in Fayetteville, kind of midway between Peachtree City and Fayetteville. So we really look forward to that. I don't know if anybody else has any other announcements, because I said we would have time for announcements at the end. Put your hand up or unmute your mic so we can just have, if there's any other organization has something that's coming up quickly that you want to share. Going once.
Hello.
Noni's raising her hand.
Okay.
Hi, Noni.
Just really quick, everyone's talking about all the services. Just remember that April 2nd through April 8th, I think we're celebrating the Week of a Young Child. As an early childhood advocate, we are advocating for the importance of high quality early childhood programs. So I'll send information out over to you, Ms. Dawn, regarding just ways that you can advocate for families in Fayette County to find high quality early child care programs.
So Oakleaf School is an early learning?
Yes, ma'am.
So
we
certainly want
birth to 12. So we have an after school program, but we do have a birth to 5 program, like a full day program for our little friends.
Well, we want to talk to you because we also have an early learning initiative. So
okay.
Put your information in the chat, please, your email.
Yes, ma'am.
Okay, thank you. Anybody else? I always like to give people back their time because it's not quite 1 o'clock. Anyone else?
Yes, me.
Okay, Noni.
Hi,
No, that's Melanie. Melanie from Bennett's Mill.
Yes. Bennett's Mill Middle School will be having a ribbon cutting for their Bronco Community Garden. So we're inviting out a small number of people to come and celebrate us. Our goal is to get the community as well as our families in to learn about gardening. It's a partnership a partnership with Project Excel Readiness Program, as well as Elevate Farms. And the chamber will be out to do the actual ribbon cutting. So we're looking forward to, a few members of the community coming by and welcoming.
When is that?
Community garden ribbon.
When
cutting.
is it?
Oh, when? I'm sorry, I forgot about that. April 21st.
April 21st.
Mhm.
What time?
And I'll send you a flyer as well from 10 a.m. to 12 p.m.
Okay, thank you for sharing.
Thank you.
Okay, anyone else? I want to thank our speakers from Healing Bridge, AVPRIDE, and from Fayette Care Clinic in sharing your information. We so appreciate everybody that comes. And next month, our speakers will be in person, and we're happy about that too. So I'm looking forward to seeing you all in person and not in a square box. So I hope you all are looking forward to that as well. If not, we will end our meeting and just thank everybody for all that you do to serve our community. We can't do it without you. And thank you for your collaboration and partnership.
Thank you, guys. Thank you, Dawn.
Thank you.